Hi, ladies and gentlemen. Welcome to yet another edition of the Cameroon Town Hall for Healthcare Professionals. Today, we are going to be talking on a very interesting topic, increasing access to preventive health care in Cameroon. And we have today one of those who are doing very amazing job in this sector. Last week, we had a very interesting topic as well. We were talking about the cholera epidemic in Cameroon, lessons learned, and it was really an interesting session. We had the honor of having with us even the regional director of health for the Southwest region and other really interesting speakers and those who joined us. Once again, it's always a pleasure to meet with you here every fortnight. We continue to bring you interesting topics here at the Cameroon Town Hall for Healthcare Professionals. As a reminder for those who might be joining for the first time, the Cameroon Town Hall for Healthcare Professionals is a platform that brings together healthcare professionals from Cameroon who are spread across different countries around the globe. And we come here every fortnight to talk on interesting topics on health and to see how we can bring all our experience both home and abroad to improve on the healthcare of our people in Cameroon. We have so far 1,246 members on our platform with a coverage of over 35 countries as of today. And we do hope that we will continue to bring you interesting topics. This is the number 53rd session, if I'm not making a mistake. Ever since we started, we have not skipped a session and our numbers keep increasing. We will continue to bring you the best that we can, and this is completely a voluntary platform where everyone serving on this platform are all volunteers, and we continue to make sure that we give a disclosure that this is a political group that is only made up of scientists and lovers of healthcare, pharmacists, doctors, nurses, researchers, public health scientists, and everyone who is just interested in improving the health of our people back home. Today we have as guest Dr. Agbo Ashu, who is the co-founder of HealthLink, one of the renowned institutions and corporations in Cameroon that is addressing the issue of access to preventive healthcare in Cameroon. Today with me, of course, we shall be moderating the session with Christelle Diego, who is our co-moderator, always present and moderating with us in French, though very bilingual, speaking sometimes very more fluently in English than I do. Welcome, Christelle, to this session.
Bonsoir Elvis, bon après-midi à chacun et merci à chacun de joindre cette édition, cette 57e édition, comme tu le disais Elvis, de Cameroon Town Hall. C'est une plateforme qui regroupe des médecins, des professionnels de santé camerounais du pays et de la diaspora pour échanger des sujets d'actualité, des sujets de santé pour améliorer l'état de santé de notre pays. Merci encore une fois de plus et merci à notre invité de ce jour, Dr. Agbo, pour son temps et pour la présentation qu'il va faire tout à l'heure. Merci. À toi, Elvis.
Thank you very much, Christelle, and it's always a pleasure to have you. We have other co-moderators who might be joining us if they are not yet on set. We have Dr. Alison Way, who is presently in Seattle. Because of some competing priorities, she might be able to join us subsequently. We also have Dr. Brian Tegomo, who is at Nebraska working with CDC. He might also join us subsequently. He's actually on the way to catch a flight. And we have Dr. Louisa Viban, who is also a resident physician in Canada. These are all co-moderators who appear here all the times to give you the best of the Cameroon Town Hall. And of course, we have our own chairman, Dr. Muno Kenneth, the reason for which we are here. Hi, Chair. Good afternoon.
Yeah. Good afternoon, Elvis. The reason why we are really here is because of you guys. You guys are the rock stars. You in particular, the whole idea for starting the town hall was to educate people about COVID. When we spoke, almost 3 years, two of us had a chat and this whole thing came to birth. And I'm happy it's still alive. And we'll still try to update them about COVID and public health issues. So maybe I would have some few updates today.
Great. And it's always a pleasure to have updates on COVID. It is through you that we know what is happening around the world as far as COVID-19 is concerned. And before we get back to you, let us just hear the voice of our guest and just to say, hello, Dr. Ashu Agbo.
Hi, Elvis. Hi, everyone. I'm honored to be here today and to be on this platform. It's not easy to be able to present and share what we are currently doing, but I'm hoping that what we share is going to be able to inspire people and also contribute in building the healthcare system in Cameroon and just bettering the lives of people in Cameroon and all over the world. Thank you for having me here, and looking forward to sharing with you what we do.
Thank you so much for accepting our invitation. I know you are, you're a guest speaker in so many places and so many countries, and also having you here is a pleasure for the town hall. Thank you so much for accepting our invitation. And now we will take you to the world of COVID-19. Let's get some updates of what is happening as far as COVID-19 is concerned. And so over to you, Dr. Monacan.
Thank you, Elvis. And so, just to say, I would really love to say a big thank you and shout out to Dr. Abov. I've been an admirer of what they have been doing when they started with Gifted Mom, right up to what they're doing right now. And I think they have had a wonderful idea on how to change healthcare and practice preventive medicine in Cameroon actively. So Elvis, I'm going to reverse this today. Today I'll start by talking about monkeypox slightly. Why? Because we're having kind of a public health emergency that is setting up. There is going to be a new form of a pandemic or a new form of an endemic in other areas. So it's important for us to know exactly. This picture really shows that there is monkeypox used to be taught as a zoonotic infection that happens in Africa, in tropical regions. But if you see in this picture, I've put in a white person because that's where the disease is going towards now. And we are really having a lot of cases which are clustering around gay populations. This is the original monkeypox since 1970 and its discovery, the areas where we've had monkeypox. We are unfortunate or fortunate in Cameroon to be one of the epicenters of monkeypox, and we have both clades of monkeypox, which is the West African and the Central African clades of the disease. So this shows you exactly what has happened between 1970 up to 2001. Here it shows you globally the countries that were infected with monkeypox during this period of time, and showing that in the US, in the United Kingdom, they were all imported cases, and in Israel. So here it shows you really the lethality and the rate of infection depending on the different clades that you have, the West African clade and the Central African clade. I'm not going to go into the details of monkeypox because we're inviting an expert in the next 2 weeks to talk to us about monkeypox. We want to get to know this. There is one of the biggest, I think she's one of the great minds setting forward about talking about monkeypox. So this is really where the situation is worldwide right now. We do have active cases in the West and very few cases that originated back in Cameroon, Central African Republic, and the Democratic Republic of Congo. Here I show you the number of new cases. Up to today, we have 100 cases in the US. If you look at this chart, this was like a week ago, there were 49 cases that were confirmed. Now there are 100 cases. And this year, you've had several cases that were suspected in Africa. In Cameroon, you did have 3 cases that were suspected this year. And out of 3 cases that were confirmed out of 28 cases that were suspected. So it's not something new, but really the pandemic is showing out to be new. Modes of transmissions are primarily infections from animals, mostly monkeys getting infected, and people who are consuming food which is not well cooked from monkeys and rodents. You do have secondary transmission that also occurs from mother to child. That can occur, and also you can have transmissions that have been reported from humans to humans. And you have modes of transmission is usually on protected contacts, respiratory droplets, you also have lesions, and then you have body fluids that can lead to contamination. So we do need to do prevention, advocacy, raise awareness, and that's what we're doing. There is a vaccine that is available, usually for healthcare workers, and this is the new phase of the disease. Here is just data I got from the CDC. About last Friday, there were just 48 cases. And right today, there are 100 cases in the US, and there are several other cases in the UK. There are also more than 100 cases. And in Canada, there are about 150 cases. So clinical symptoms, really, we need to have a high index of suspicion, especially in areas where we're having this. Right now, the pandemic, what we are seeing now in the cases is we're seeing a cluster of cases where people are presenting with anal rashes that look like vesicular lesions, and mostly among gay men. And these are the lesions that were published in 2013 in the US when we had some few cases that erupted in the US. These are lesions that were published just in May and June. Here you see that there is some differences. You're seeing firm, deep-seated, and well-circumscribed lesions that are appearing. So here is what we got from the UK, from the NHS in the UK. These are lesions that have been reported in some few cases. And we do know that right now you're able to obtain specimens in the US. We're able to obtain specimens in the UK and actually diagnose them. All the reference labs which are run by the CDC are able to, there are 64 of them, they're able to actually carry out diagnosis. And also they're trying to do some gene sequencing to figure out the difference between this and the original clades that we had. So right now we do have vaccines that are available, but they're not available to the general public. There's the ACAM 200, and there is the other vaccine which are used usually for healthcare workers. And also right now we're vaccinating those who have been pre-exposed. And there is also medication, which does not have an FDA approval, but these are medications that were on clinical trial, and we tend to give those who have been exposed and those who have, and treat those who have severe disease. And we're going to talk about detailing about this, I think, in the next 2 weeks, and give you a lot of update concerning this. This is just the tip of the iceberg of what is happening. Now, going back to COVID, we do know that the Omicron, BA4 and 5 are taking over. And here you can see just a cartoon representation where the BA2 used to be ahead, the BA4 and 5 used to be behind, but right now it's getting to the front position. So here you can see from the Wall Street Journal, 2 more Omicron variants are spreading, and this is actually BA5 and BA4. We have not had a new variant yet, but when are we going to have it? This cartoon just represents what is happening in our lives today. We get vaccinated, we get COVID, we go for a wedding, then you get COVID, then you get vaccinated, then you get COVID. So there's a lot of reinfection. The good thing is the number of people dying are actually few because of vaccination. Globally, the number of people getting COVID is actually reducing, which is a good thing. Now, we do know children get infected. And this week, just yesterday, we had a good news. The FDA approved the vaccine for children. Both Pfizer and Moderna were approved. The question is how many people are going to get their kids vaccinated? We need a lot of information into telling them why it's important to vaccinate kids in order to reduce the prevalence of the disease circulating. So there is also long COVID, which is interesting to know exactly what is happening. This week also, last 2 days, there was a big revelation in the pathophysiology telling us that we do have tiny blood clots, we do have persistence of the virus, and then we also have malformation of our immune system responsible for long COVID. Here is just showing you that we can also use other technologies in order to be able to diagnose COVID patients. Here is using canines in order to diagnose COVID patients, and the efficacy and efficiency was almost 98%. Now, the technology we have developed from COVID, we can use it and harness it in other things. Now, there's a lot of clinical trials trying to look at messenger RNA vaccines in other viruses that we do not have vaccines for, and even in malaria parasites, which we just had an FDA approval, but we are having other research going on. Here we do have in oncology and in virology also, we're getting into trying to create oncovaccines for different cancers, and we're also trying to treat neurodegenerative diseases, as you can see in this slide. And there's also improvement in the lipid nanoparticles in order to deliver these messenger RNAs in the body. So this COVID has not come only with kind of a bad connotation. There is good science behind COVID, which is improving other diseases. Here we can see that as the COVID virus is getting better, its also transmissibility is increasing, and the R0 is also increasing, but the number of deaths is reducing because the number of people who have been vaccinated have increased. I'm just worried about Africa, and I still get worried, but for some reason which we don't know all the explanations, we are being spared. Now, are we going to stop having new variants? The answer is no. We're still going to keep having new variants because we have reservoirs in animals. We have people who are not immune. Nobody is wearing a mask anymore, and there is co-infections, which is going to lead to new variant. The problem is when and how efficacious, how good is the healthcare system to catch these new variants. Now, this pandemic also was a pandemic to reveal how bad certain healthcare systems are, including the US, where the number of deaths was actually the 4th or the 5th largest in the world based on the population, the percentage of people who died from COVID, which is very shameful. Here you can see that the pandemic is not yet over. There is the BA4 and 5, which is running a new wave starting in Europe and in the US. So here you can see in the US, the number of cases are rising, but the number of deaths is staying constant. This is just 1 month ago, and now you're seeing the number of cases are actually rising. The good thing is the number of deaths and number of hospitalizations are not. Sewage systems are the best ways. Now that we're testing at home, it's difficult to trace what we're doing. So here you can see data from Minnesota really predicting the different variants, and they were able to pick it up in the sewage system. I just put this here showing you that masks do work, and there is new data coming out showing that masks work, and the kind of mask matters, but actually just putting on a mask really works. But there is a lot of information out there trying to discredit this. And COVID-19 at a certain period had more deaths than cardiovascular diseases in the US. So these are the areas where you still have a number of COVID cases. Africa is really spared. There's some countries in Africa, including Cameroon, where data is hard to find. And here is just data showing you exactly what is happening in the US, the different variants that are circulating and subvariants. Here is just showing you the difference between the BA4 and BA5 variants that are now present and how they differ from the original Omicron variant. And here you can see the different lineages for those who are interested in gene sequencing. And here you can actually see that there's progression in immune escape as you and increased transmissibility from one variant to the other. So we do know that the COVID pandemic is not over. We're trying to shut down the door, but the door still stays open. We are trying to run to the finish line, but we cannot get to the finish line just like this if we keep doing what we're doing. So we need multiple measures in order to fight COVID. And I think we're doing that right now. We just need to insist on the different measures. 2022 has been the time for therapeutics. And we're now at the end of the road to decide what to do next. So here you can see that the number of cases in the world is actually staying, not increasing drastically, but we had in the past 28 days, we've had 13 million new cases. And we've still had almost 40,000 deaths worldwide. Here is the world, here is Cameroon. The number of cases have not increased. It shows that for the past 1 month, there have been no COVID cases in Cameroon, or there's a problem in reporting. So the US actually here, you can see almost 1 million cases have increased for the past 2 weeks. Vaccination has gotten better. COVID has just shown us how easy it is for us if scientists put their minds together to get a good vaccine. And we do have 12 billion shots of the COVID vaccine has been given. This is the highest vaccines that have been given to people worldwide ever. So we should be very able to tell what the side effects are. Cameroon is still lacking. Only about 6.9% of the Cameroon population has had the vaccination. And the poor countries are also still lacking. And the high income countries have vaccinated more than the low income countries, which there's really disparity is something we need to talk about. Also, the kind of vaccine we got as poor countries, most poor countries got the Oxford AstraZeneca vaccine. And we also got vaccine from the Sinopharma, and the Sinovacs, which are more or less efficacious compared to the mRNA vaccines. So here is just data showing you that vaccines do work, and those who are vaccinated and gotten boosters are less likely to die from COVID. So here is also some of that data for 3 shots and 3 and 4 shots. So getting a second booster is good for those who are above 65 years old. And here it just shows you the number of people who die, who compared to the number of people who are vaccinated versus those who are unvaccinated. So I always say there was no time like in between 2000 and 2020 and 2021. You could see that science actually did a marvelous thing in order to get us a vaccine, get us therapeutics for the disease that we just had. So the plan is, when is it going to be? Is this the last variant? I don't think so. We are hoping there's going to be a new variant. It's how ready we're going to be. When are we going to have Pi? And I hope the world doesn't lock itself up the way it did for Omicron. So please, if you are not muted, please mute yourselves, please.
Yeah, please, there's somebody, Brenda, maybe you have to mute your microphone. Thank you.
So we do know that there is The cold chain is a big problem in Africa and has been a problem for a long time. So we really need to work on the cold chain. And when are we going to have a universal vaccine? I think the time is soon. There are several research organizations working on getting a universal vaccine. Now, in terms of therapeutics, not much has changed. I think I spoke about this corticosteroids. For those who are back home, it's available. We can use dexamethasone, hydrocortisone, methylprednisolone, and prednisolone can also be used, and prednisone can be used in order to treat COVID, especially those who have severe disease. Now, for those who have severe disease and are progressing on steroids, tocilizumab is very expensive, not available in most countries in Africa, and still a patent drug, and it costs thousands of dollars. But baricitinib, on the other hand, I think it's been made available. The company actually pledged to make it available to Africa, so you can actually combine it with dexamethasone in patients who have severe disease. Now you do have Paxlovid, which works in patients who have mild disease and prevents people from dying, 80% prevention of death. Here is the clinical trial that was published in the New England Journal of Medicine. You do have Paxlovid and molnupiravir. Here is their mechanism of action. So it's important for us to know that we do have tools that we can use. We have monoclonal antibodies. We also have remdesivir, which can be used in mild cases. WHO actually gave an okay for it to be used in mild cases, but it's still very expensive and not affordable in Africa. So there are tools. The Evershell is also a monoclonal antibody we do use for those who cannot get vaccinated and those who are cancer patients. We give it to our patients, and it does prevent them from getting COVID for 6 months. So they can get a shot every 6 months. So things that did not really work, antiretroviral treatments, ivermectin did not work. And we do know convalescent plasma also is controversial. The data, hydroxychloroquine did not work, and antiretrovirals for HIV did not work. So I can tell you that we've gone a long way. And so in order for me not to take much time, I think I'm going to end here. This is just a summary that the recovery trial that was run in the UK was an ideal model for us to move forward. And I think even the US has to learn from this. During the recovery trial, we actually led to the development of dexamethasone, tocilizumab, baricitinib, multiple monoclonal antibodies. Just one trial led to us approving all of this medication. So we should continue doing research, and we should know that in the face of a pandemic like monkeypox coming up right now, we are going to see if we have learned from COVID. There are two different diseases. The pox virus is completely different. So Elvis, over to you. And thank you everyone for listening.
Thank you so much, Dr. Mona, for this really, really great presentation, especially starting with one of the issues that is contemporary now, that of monkeypox. But just a question before we get to the main topic for today. The United States kind of relaxed their policy on entry at the borders that initially required a negative COVID-19 PCR test. At this point in time, do you think it's an example other countries should copy? For example, Cameroon.
I think yes, and I'm going to tell you why. Because it's not been efficacious. It's not been effective, really. The measures that they have taken, trying to test people. If you have moved around, you realize that you could get a positive test and still get yourself exposed and still transmit the virus within the time that they said you were tested. But also, it's just one of those things I feel that we should make reasonable decisions that can help us keep the economy alive and also help us move around the world without discrimination. Meaning what? I personally don't have a problem with masks because I know they work. I know there's been a lot of debate. I prefer you getting people put on a mask right now, getting them, the aspect of getting testing prior to traveling is very tedious, it's not cost effective, very difficult for airlines to deal with. And if you have been traveling, you realize that internal travels in the US, you don't need that. And also you need to put on a mask, but external travelers have to get tested while those who are traveling internally did not have. And other countries like in Africa, Cameroon in particular, people are buying the test. So it's just an aspect of creating more either you get very strict on how to get tested and people get tested and you make them available in the airport and you make PCRs available, or you put in a measure in place where you don't create a situation where people would enrich themselves and they're also going to extort people. I know a lot of people who were COVID positive, I'm not going to give their names, who were COVID positive, traveled from the US to Cameroon and bought a test and traveled back. So it means they may have infected everyone in the plane. So in a country like that, I'm saying this publicly because it happens in Cameroon.
Thank you. I know that early on during this pandemic, you and Dr. Kenji at Stanford Health were proponents of the fact that you can test yourself out of the pandemic. Now, do you think we can test ourselves out of the pandemic or we can vaccinate ourselves out of the pandemic? Where do you stand? You seem to have shifted. And why?
No, I've not shifted. I think you need a switch model, a Swiss sandwich model, what I call like a cheese model, sorry, where you need to do multiple things at once. You cannot do a single thing and get yourself out of this pandemic. No. We should just try to make decisions that are logical. I don't think shutting down the government or shutting down a city helps in any way because most transmissions occur inside the household. One person brings it and everyone gets infected. Two, I believe testing yourself out of the pandemic is making rapid tests available. People can test themselves before they get to work. People can even test themselves before they get to the airport. If it's available, accessible, not necessarily running a PCR for everyone, but you need to be able to do that. And also treating yourself out of the pandemic is a possibility now. We do have medications that do work. Vaccinating yourself out of the pandemic, it's the key. I'm a believer of vaccines. And depending on what kind of vaccines you have, this vaccine really works in preventing disease and severe disease and people from dying. So believer of vaccines because there is data behind vaccines. If you look at WHO publication in Millennia publication in 2000, the single thing that reduced mortality for humans worldwide was the discovery of the vaccine. The first was sanitation and hygiene. A lot of people don't know that. The second was the discovery of the vaccine. The third was discovery of antibiotics. The rest of the things we do in healthcare, cardiac catheterization, oncology, I'm an oncologist. Treating all oncology patients in the world did not make a difference statistically. You will not believe that, but that's the truth. In improving even your life expectancy by 1 year. Last year was the first time we had evidence that treating patients with lung cancer actually improves mortality. So this tells you that the basic things we do in preventive medicine, which is leading to the topic of today, basic things we do in preventive medicine go a long way. It's just, it helps, it affects our egos as doctors and practicing in hospitals that big data like that doesn't reflect into what we have done for long. The main things that have reduced mortality worldwide has been hygiene and sanitation. The father of public health, John Snow, when he closed the tap in London and reduced cholera or shut down cholera in all of London, that was the beginning of it. The discovery of vaccinia for smallpox was the beginning of it. Hygiene and sanitation, preventive medicine, getting the link between smoking and lung cancer, and stopping cigarettes and putting all the measures to stop people from smoking is what actually got us here in improving mortality. Okay. But not prescribing all the drugs, doing cardiac catheterization, investing billions, all of that has not proven or has not panned out to show that there have been any increase in life expectancy if you do a meta-analysis of all the data.
That is interesting. And that is why today we have with us Dr. Agbo Ashu, who is a trusted authority in the field of preventive health and who is going to be telling us about access to preventive health in Cameroon. We have heard in several languages and in several ways in which it is being said that prevention is better than cure. And today we are going to get someone who is going to really just bring this to the reality of what is happening in Cameroon. Dr. Ashu Agbo is the co-founder of Health Lane. I would want to call on Christelle to present to us our speaker for today. Christelle, à vous l'antenne, as they say on CRTV.
Yeah, merci Elvis. C'est un honneur pour moi et un privilège de présenter le docteur Agbo Ashu. Dr. Akbar is a Cameroonian medical doctor. He graduated 8 years ago from Excuse Faculty of Medicine. He has a great passion and is enthusiastic about digital technologies, especially to save lives and optimize health. He has a lot of experience in mobile health, and he acted as consultant for mobile health solution for the Gavi, the Vaccine Alliance, the World Bank, the United Nations for Development Funds, Plan International, and also he has been keynote speakers addressing several issues related to digital technologies and development, particularly focused in the area of healthcare. Regarding his experience, in addition of being a medical doctor and a passionate of digital health, he's a good leader so far. He's the founder of HealthLane. He has been managing this structure for more than 2 years now. And also, he acted as medical director of Gifted Mom. We heard about it during the introduction with the chairman. And Gifted Mom provided life-saving health information, quality, and affordable care to expand moms in Africa during more than 5 years. It was a successful project where he was able to raise up to $1.9 million with Gavi, the Vaccine Alliance, to improve vaccination outcome in Mauritania and many other countries. This work has impacted more than 500,000 moms across different platforms, SMS, USSD, chat box in Cameroon, Nigeria, Cote d'Ivoire, and several other countries. Dr. Akbar has several certifications. I will not list all of them, but I'll pick some among them. So he has a certification on project management professionals and also fitness, nutrition, and certification. He has several skills: business relationship, team management, public speaking, public health as well, research. Regarding the honors and awards he has obtained so far, he was a fellow of the Commonwealth Youth Award for Best e-health application in 2016. Additionally, he received La France s'engage au Sud Award for Best e-health application. So from here, you get that we have one of the best e-health manager or software manager who knows what he's talking about today, as well as Digital Africa Awards from l'Agence Française de Développement in 2017. Dr. Akbar Ashu, we are very proud to have you today. We are happy about all the work you are doing to save life in our country and worldwide. And we are pleased to have you. Please, you have the floor. And thank you for having time for Cameroon Town Hall. I hope to have been faithful.
You have done a very great job. And before I give it over to Dr. Ashu, he is a very good chorister as well. I would not forget to say that. And if you watch him sing or listen to him sing the HTC choir in Simeon, you would understand what I mean. Dr. Ashu, you have the floor.
Thank you so much, Elvis, and thanks a lot, Christelle. Thanks, Dr. Mono, also for the invitation and for everyone that is currently here on the platform. I'm hoping that at the end of this session, we must have educated ourselves and gained some insights that is going to help us improve access to preventive health, which is something I'm really very passionate about, because I really believe that lots of things, as Dr. Mono has already highlighted, can be prevented today. And prevention can also improve our life expectancy and also move us to the next level. So I'm honored today to present to you about increasing access to preventive health in Cameroon. And I'll basically move from context. I'll have a context, talk about a little bit about preventive health, where we are in Cameroon, just a little bit, and some of the gaps, health lane, and then the conclusion. So today there has been a double burden of infectious and non-communicable diseases, such as cardiovascular diseases, cancers, diabetes, chronic respiratory diseases. And this has occurred as a result of several factors. Today, increase and unplanned urbanization. I mean, we are seeing a lot of economic growth, but this is also coming with problems, or a lot of urbanization, but this is also coming with problems. Sometimes it's unplanned, and so we have things like air pollution and stuff that are increasing, like the burden of the diseases that we are having today. Also, some of the factors that have led to the double burden of these NCDs and infectious diseases are the way we have moved from the agrarian to wage economy city lifestyle. That's basically, we know in those days our parents used to do a lot of farming, they used to cultivate a lot and be physically active. So today we are spending a lot of time in the offices and in front of our laptops and computers, just sitting, taking our snacks and writing and doing everything while sitting down. So that also has contributed to what we are currently having today in terms of non-communicable diseases. And we also have, in terms of adoption of unhealthy lifestyle, we know as with the rapid urbanization, we have the Western lifestyle that is beginning to penetrate in our societies today. And I'll already be very basic in the way I'm doing the presentation. We have a little things when people go out today is to eat things like shawarma, hamburger, and of course in the offices, once you can eat your chips and your granite during break. Meanwhile, in those days, you already had maybe our parents carrying food along to the office that was well cooked and all these stuffs. These are the little things that have increased like the burden of infectious and non-communicable diseases in our context. And consequently, in 2018, WHO reported that 35% of all deaths in Cameroon were due to non-communicable diseases. Like I said, things around diabetes, cardiovascular diseases, chronic respiratory diseases. And today we see obesity is on the rise, and many people are seeing it as being culturally prosperous, like in our context. When you are fat, when you are healthy and you are bulky, you have a very big stomach, they say, okay, no, you are eating money, you are very prosperous and stuff. And this concept has made a lot of people becoming more and more obese, and we are not recognizing this. And of course, 20%, there's a 20% probability of dying between ages of 30 and 70 years if we don't take into account some of the preventive habits. We have this huge probability. Life expectancy is going to be reduced, and there is need, and that's why it's important for us to be able to present what we are doing today on increasing access to preventive health care for everyone. The good news is that non-communicable diseases are the world's leading forms of preventable illnesses. I'm talking a little much more about non-communicable diseases because it's been one of the neglected areas. In Cameroon, we focus more on communicable diseases, the TB, the HIV, the malaria, and we've forgotten that there is a huge rise in non-communicable diseases, the cardiovascular disease, the diabetes, the hypertension, and this is reducing the life expectancy of many youths, of many people nowadays. And now, like I said, non-communicable diseases and most of the communicable diseases that we have are the world's leading forms of preventable illnesses, meaning basically they can actually be prevented if we have the right attitudes and implement the right habits. Talking a little bit about what preventive healthcare is about. So preventive healthcare has to deal with the prevention of illness to decrease the burden of disease and any associated risk factors. And preventive healthcare, unlike curative healthcare, is much more proactive than reactive. In a preventive healthcare setting, in a curative healthcare setting, you wait to be sick, then you go to the hospital, the doctor consults you, does your lab tests to identify what may have been causing the illness, and then puts you on medications. And then once you're treated with medications, you go back to your regular lifestyle, and the sequence keeps continuing. Meanwhile, in preventive healthcare, the focus is before you fall sick, what do you need to do? And that's why it's a much more proactive system than a reactive
Yeah,
system.
how are you? I saw your message. Good.
So today, there are four different levels of prevention when we're talking about preventive healthcare. The first is primordial prevention, and these are actions that are taken to prevent future hazards to health and to decrease those factors which are known to increase the risks of diseases. Dr. Mono already mentioned hygiene and sanitation, air pollution. If we have to, those are primordial levels of prevention. So cleaning the areas around us. If we need to prevent malaria, we need to clean the areas around us. If we need to prevent lung cancer and lung diseases, we need to ensure that the air is conducive enough for people to be able to breathe. We need to reduce the gas emission. We do not pollute the environment. That's what we call primordial prevention. When it comes to primary prevention, it's about preventing the onset of chronic disease by reducing the risk factors for development. And for example, if you have, we have vaccination, because you have things like typhoid, you have things like meningitis, where we have vaccines, we have cholera, the vaccines that are all available today. These are all primary levels of prevention. We have instituting better lifestyle, such as reducing smoking, that's tobacco, such as reducing tobacco, such as eating healthy vegetables, practicing physical exercise. All of these constitute what is known as primary prevention. Also, we have secondary prevention, which involves the detection and treatment of preclinical changes. So this involves things like screening for cancers, where you have to do mammography, for example, you do a prostate-specific antigen. And the emphasis here is on the patient engagement. So in secondary prevention, sometimes you may do a blood work, you may go to the hospital and you detect that, okay, you are already pre-hypertensive, and they already have to start putting some things in place that are going to prevent you from getting into the disease stage. So that's what secondary prevention is being constituted. While tertiary prevention focuses on arresting diseases and even reversing, which are things that sometimes we don't talk about, things around diabetes, around hypertension, which are all things that could be reversible. So that's what tertiary prevention is all about. In some other classifications, they add things like quaternary prevention, where you have to take off some medications that are already causing disease burden on the persons. But for the purpose of our presentation today, I'm going to focus on these 4 different levels, and we are going to see where the government is intervening and where we are also intervening as an organization or as a company, Health Lane. So today in Cameroon, the bad news is our healthcare system has been designed to focus more on preventive healthcare. So to focus more on curative healthcare. So waiting for people to be sick, and then you go to the hospital and you receive treatment. Just a short story. I mean, recently the delegation sent people to come and verify what we're currently doing in our company at HealthLink. And once we explained to them what we're doing, there wasn't any particular area that they could position us as, whether it's a hospital or it's a diagnostic center or whatever it is. And that's because the healthcare system has been designed in such a way that things around wellness, things around prevention cannot fit directly into the structure. But of course, when it comes to prevention, the government has instituted policies and things that are currently working, things around vaccination. We have a whole expanded program on immunization. We have things around preventing tuberculosis, things around management of tuberculosis. We have things around preventing HIV, which have all been put in place by the government in terms of preventive measures. We also have different policies that have been put in place. They exist, but the implementation in one sense or the other is not very effective, around tobacco use, around alcohol use, and even around physical activity, how to implement that as government policies for us today in Cameroon. So there are policies that exist, but they are not effectively implemented because the way the system is designed in such a way that we wait for people to get sick and we go to the hospital and we get treatment. Today in the private sector around prevention, of course, there are policies around workers doing screening tests before they are being recruited. We have policies around annual health checks for different workers. We have different health days that are occurring in different companies for health education, information, and communication. These have all been implemented around the private sector. And we also have, like, at individual levels where more and more people are becoming conscious about this disease burden, where you see a lot of people dying from cancers and from hypertension and from diabetes at early ages. So individuals are becoming much more conscious. When you move along the road on Sunday or Saturday mornings, you see people running up and down and trying to be much more physical active, and people are becoming much more health conscious. Some people are taking supplements, some people are going to the gyms, some people are adopting healthy lifestyle. All of these are individual measures that are being implemented in Cameroon by different individuals today when it comes to prevention. But of course, there are gaps that exist today in Cameroon, and it's really, like I said, the healthcare system really designed to support a lot more around sick care. There are no national, even NCD prevention policies that are being effectively implemented, sometimes maybe due to political wills, and sometimes maybe because there is no ministerial support, because of course it needs collaboration amongst the different ministries to be able to implement preventive health measures. Like we said, primordial, there is secondary, there is tertiary, there is a primary. And now, why am I saying there is a gap? It's not the Ministry of, it may not only be the Ministry of Health's place in order to reduce air pollution and stuff, because this is a form of primordial prevention. Even when it comes to tobacco use, smoke-free areas, reducing tobacco, is not just a problem of the Ministry of Public Health, it's a problem of every other ministry, and every other stakeholder has to be involved in implementing primordial or primary preventive methods. Also, in terms of healthcare financing, today access in terms of costs, in terms of insurance, are currently unavailable when it comes to preventive health care. So usually when people want to go and do a preventive health check, some insurance may not be able to cover some of these preventive health checks. Insurance may not be able to cover some of these preventive health checks. Meanwhile, these are things that are also important to reduce healthcare costs. But there is also things around fraud when it comes to insurance and to some of these policies that makes it difficult for people to even access preventive health care. And also the gaps is really in terms of culture. So we have individual cultures. Like I said, people see being obese or being fat as you are prosperous, or you are rich, or you are actually doing well. These are all cultural perspectives that has led to the gap. So there's a little promotion in terms of awareness of what is happening around preventive healthcare, and that's why we are where we are today. And it's estimated that if we do not put in place measures, preventive health measures, then the disease burden is going to increase and many more people are going to die. In fact, it's estimated globally that by 2030, 52 million people are going to die from non-communicable diseases, which is about 5 times greater than what happens, deaths due to infections. So it's absolutely important that we begin to put in place measures that are important to help the general population, that are important to help individuals to cultivate healthy lifestyle. Like I said, because things are beginning to change, there is the shift that we are having in terms of infectious disease to non-communicable diseases today, the diabetes and the hypertension, and we need to take action now. So, of course, what are we able to do in our own area? Because we know that, of course, the government cannot be able to implement everything around the different prevention arms, but of course they have a place to play, and it's multi-stakeholder engagement that needs to be implemented. Back in 2015, remember how we started in the days of Gifted Mom, where to be able to support in terms of vaccination. The vaccines were available, but there were lots and lots of people that were missing their vaccine appointments because they forgot the date. It was not an emergency, so people didn't need to go to the hospital to vaccinate either their children. Of course, their children were not sick. That's how our brains were being tuned. So vaccination to us was not a priority. So in the days of Gifted Mom, in 2015, we developed an automated SMS and voice messaging platform that sends notifications to pregnant women, nursing mothers, to remind them about their next vaccine appointment, and also to educate them on things that can be able to lead to the death of the child and things that they could be able to avoid. This is both for pregnant women and for nursing mothers. And we've seen an increase in vaccination outcomes, which of course contributes to the life expectancy of different individuals. And also through the education platform that we had with Gifted Mom, also really improve hygiene, sanitation of the different pregnant women and the nursing mothers, and also just empowering them with the knowledge that they needed to be able to live better and healthier even for their babies. Of course, there were gaps in those areas, and when we fast forward to 2020, 2021, we decided to shift and to focus to not just on pregnant women and nursing mothers, but a more holistic approach and for individuals. And that's why we pivoted from Gifted Mom to HealthLane, and it's a preventive health company offering comprehensive wellness checks, personalized care plans, and health coaching to different individuals. And our vision is really to enable individuals spend quality years with their loved ones and achieving the purposes for which they were created to be. And our mission really is to simplify the way people understand, track, improve their health, enabling longer and healthier lives. Today, how do we do that? Like I said, I'd already mentioned some of the gaps that existed already, and also what are the different prevention levels and what we are currently doing to be able to bridge the gap for those prevention levels. So we've set up facilities today in Cameroon and in Nigeria to be able to get people on the health lane, just like you've seen. Health lane, the lane, I mean, moving from sick care to preventive health care. So what we do is that we do a risk analysis or risk profiling of individuals that come to us, understanding from your history, what are the things that you are doing? Are you exercising? What kind of work are you currently being engaged in? What kind of things are you currently doing that could put you at risk of developing a particular disease? It could be sexually transmissible infections. It could be diabetes. It could be hypertension. But we also blend it with your medical history. So just getting information about your past medical history. Are there any other risks that could be able to hinder you from attaining maybe some of the objectives that you have to attain? So once we have all of that, we then compile that information with a blood and urine screening analysis or a body composition analysis, which is really very extensive, cutting across several systems and several organs, just because we want a holistic approach to be able to help people live healthier and better. So once we've done that screening, then what we do is that we then we do a presentation of the different lab results and a presentation of the different things that we are currently seeing based on the person's profile and based on the person's blood, urine, and body analysis works. And then we put the person on a particular program. Of course, not everybody is diabetic who comes to us. Not everybody is hypertensive who comes to us. Not everybody has an STI who comes to us. But we are able to detect people that are at risk of getting to these stages and preventing them before they occur. And that's why we have to do this extensive presentation and this extensive and this comprehensive analysis. And at the end of the day, of course, it's very important because digital technology is a very important tool to be able to improve access. So all of these data that we've collected in terms of your risk profile, in terms of your lab results, in terms of your program that we want you to be on, we make sure that this is available on a smartphone application and you can always keep monitoring. So this is the HealthLane way that we are implementing. But added to that, we have other ways in which we educate people and the general public on the importance of prevention and preventive habits, because this is going to help improve like the life expectancy. So we have several programs depending on what we currently see. So it could be a weight management program. And weight management is not just about people wanting to lose weight. If you want to live, if you want to have a body of a 25-year-old when you're 40 years, you don't want to be fragile, there is muscles that you may need to develop, and we need to inform you about that. If you're diabetic and hypertensive, there is a reversal program. These are all things that are reversible. Like we said, this enters under secondary prevention. But of course, these are things that we were not taught in school. So we were not taught extensively in terms of prevention in school. So we get to discover as science is evolving that there are lots of things that we can be able to avert as time is going by. STI prevention programs, we have that also available. And in an STI prevention program, this is just about educating people. This is just about telling them how to prevent different STIs, even the HIV prevention program. Today we are hearing a lot about condoms, but very little about pre-exposure prophylaxis. In several countries, we've heard about pre-exposure prophylaxis, where people are taking it to prevent HIV. But in our context in Cameroon, this is something that is not propagated because we were not having that mindset. This is just the beginning, and we believe that people begin to become aware of some of these therapies or some of these methods that can be able to prevent them from falling sick. Aging and longevity, this is just about checking different parameters. Immunization, as children, our parents took us for immunization. We are also taking our children for immunization. But once they get old, we forget to know that there are booster doses of different vaccines that exist. So immunization, several people that have come to us we've told them, look, you need to be vaccinated for typhoid, and people are surprised that there is a typhoid vaccine. Meanwhile, they took it in the expanded program on immunization. And that's because there is little awareness. As people get old, there is less consciousness about the health and little more focus on the achievements that they want to be able to do. So prevention, like we've all said, is better than cure. However, there are several ways we can be able to prevent, and it needs each and every one of us to be proactive and definitely engaged in that. This is what we are implementing at a small level at HealthLane. This is not going to solve the non-communicable disease problem. It's not going to solve the communicable disease problem. It's not going to solve the infectious disease problem globally, but it's a place to start. And of course, we need the collaboration with different specialists to be able to push forward this solution, to be able to push prevention in our Cameroonian context. We need research and development, either with the existing data or ways in which we could be able to improve. So we don't have it all. So we need, for those that are in Cameroon Town Hall, if you're a researcher and you are interested in preventive healthcare and you want to collaborate with us, we are open to that, just so that we can also be able to reduce the burden of disease, and we are contributing at all levels. And of course, we need referrals and recommendations. We need people to be able to know that there are things that can be prevented and they need to take active participation. We do this today through different programs that we are having, and we are hopeful that at the end of this presentation, we can be able to get people being referred, people recommended, and people practicing more preventive habits. In conclusion, I'd like to say also that there are several diseases that we are suffering from today, especially even as youths, due to the rapid urbanization, due to the rapid grow due to the adoption of unhealthy lifestyle, which could definitely be prevented. And together, I believe that if we work together, I believe that if we, with platforms like the Cameroon Town Hall, where we are able to express some of the things that we are currently doing, we can be able to improve the life expectancy of different individuals. So I may not have said it all, but I mean, we are definitely open for all of your questions, your contributions, so that we can be able to help many more individuals. So thank you all so much, and we are ready for your contributions and questions. Thank you.
Wow. Thank you very much, Dr. Agbo Ashu, for this wonderful presentation. You can stop sharing your screen while we see the bright faces of all those who have been brightened by your presentation. It's really been a great presentation. We've learned a lot, and I would not tell you how much I learned, but one interesting part is that I was getting anxious that I'm getting older faster, but you told me there are some muscles you can touch for me to slow down a bit. I hope I will jump to help learn to know what those muscles are, because I don't want to get old. All right. Thank you very much, Christelle. Do you want to get old?
No one wants to get old, pas moi. Je vis
Okay.
longtemps auprès des personnes que j'aime, comme a dit Dr. Bon, merci beaucoup, c'était intéressant.
Yeah, thank you very much. And I saw one of our presenters, Therese, is online. Therese, welcome to the session. I know you're very busy, even if you cannot show your face, maybe your voice.
Hi, Elvis, and hi, Christelle, and hi, Dr. Foma. Thank you so much, Dr. Agbachu, for that great presentation. None of us want to get old, and this is an interesting one. I've always been thinking of what can make you not to get old that much, and and this is, I need to implement this for sure. I need to implement this. So thank you for that presentation.
Thank you so much, Therese, for joining in despite your competing priorities. We have heard so many things from Dr. Ashu Agbo, and I know we are excited about this topic for today, and so many questions are already getting ready to be asked. And at this point, I will hand over to Therese to do the calls for those whose hands are up for questions.
Okay, so I'm gonna start with Leo Mini. Please, when you want to ask your question, please just tell us where you're coming from, present yourself, and then you can ask your question. Then we go from there, please.
Is Leo in the house?
Leo Mimi's gone.
Okay.
Okay, so we're gonna go to Ahmed. Ahmed.
Okay, so thank you very much, everyone, for the wonderful presentation. I'm Ibrahim Ahmad by name, and also a co-founder of my own One Health club from Niger Republic. But I'm currently working as international staff covering 3 countries. So my question, or rather to say a recommendation, of course, I saw a lot of a very good presentation from the last presenter. So my comment is that I just wanted to know really about the behavioral change and also the hesitancy of immunization towards Cameroon level. And the last comment, I really wanted to know or to really understand the context about One Health related to preventive healthcare at Cameroon level. So I don't know, it's just I'm currently doing one research, so it will be very great if I can get the feedback. Thank you.
Great. And Dr. Akbar, you can choose to answer the questions as they come in.
All right. Thank you, Elvis. So the first question around behavioral change. Like I said, it's the way we were conditioned to really focus around sick care. So until it becomes worse before you go into the hospital. it's difficult for people to really change and move from that. But what we are currently seeing is that those that have come to the facility and have had that experience, more than 50% of them are beginning to implement some form of healthy lifestyle. And the reason for this is because they have the data that is available to be able to tell them that you are at risk of developing these. Without that data, most times people are not able to change. So that's why the data that we provide after the analysis helps in the behavioral change. In terms of vaccine hesitancy, for all the other vaccines that we know, for those that have been put on the vaccination program, I mean, all the other vaccines apart from the novel COVID-19 vaccine, most people are always very open for these vaccines because they never knew that they could take some of these vaccines as booster doses. That's the tetanus, diphtheria, pertussis vaccine, Tdap, the hepatitis B vaccine, and the typhoid vaccine, and the HPV vaccine. We have people that are already showing that this is important for them, and so there is no hesitancy in terms of vaccination in that line. Those that hesitate, of course, with the coming of COVID-19 vaccine, there was some level of hesitancy because people felt like, oh, I'm not ready for any form of vaccine, so let's just leave it at that. But with more and more education and the importance of all of these, then we see more and more people adopting vaccine as part of their program. Thank you.
Thank you so much, Ahmed. I see you have your hand up. Can you just ask you quick questions and you want to follow up, Ahmed?
He's indicated.
Well, I just really want to really thank him because I have really learned a lot from the process. Well, thank you very much, everyone. Thank you.
Oh, you're welcome. Thank you so much, Ahmed. We're gonna go next to EN. Please tell us who you are, where you're calling from, and then you can ask your question.
Okay. Hi, I hope you can get me. So I'm Eyole Njaku. I'm a second-year registrar in the University of Nairobi. So I'm talking from Kenya. So my question goes to our presenter, Dr. Agba Ashu. So Ashu, as you said, preventive, but back home in our context, it's not really something we do often, like you mentioned. Now, my question is, most of the time we have seen posts online where people say, drink this or take this tablet, you prevent you from having hernias, or you prevent, I don't know. There's a mindset of certain things that are out there. I won't say they don't work because I don't have statistics. That sometimes tends to tell the Cameroonian population, if you take this over a period of time, you will not have this. So bringing into place what you do, knowing medicine is science, what evidence do you tell maybe the people who visit you at Health Lane, you tell them, this has shown this, and this is what science says? Or do you just ignore what is done behind the doors and people selling concoctions and telling people, if you do this, you will not have this? Do you also educate them, or you only prove to them that by doing this or by checking yourself, you will not have this? Another thing I was wondering was, I know a lot of research has been done back home, but in the preventive or the diseases you are doing, or maybe everything, do we have first-hand information back home? Do we have research back home that has shown? Because most of the time these studies are done in the US and they say, okay, it's if you don't smoke, you would not have this. Do we have some data back home that we can use also? Like when people visit, you tell them this study was carried out in Bonabrizo or I don't know where, and it showed that people that were not doing this had a less risk of having this cancer with respect to other people. So I just want to have some clarifications on those 2 points. Thank you.
Thanks, Dr. Eyole. So the first question around what evidence do we tell those that already use maybe like supplements or concoctions once they come there? So the first thing is, we normally, from your blood and your urine analysis, we are able to tell where you are currently, because that's the data that we can be able to grab to see whether this is progressing, whether this is moving or not. So we have a baseline. That's why we always collect the baseline to know that whether this concoction, is it affecting your liver? Is it affecting your kidney? When you were taking the concoction, what were you thinking of? And let's see whether this is actually happening. A very good example maybe is people who are taking, let's say calcium, because they've told them that, look, when you take calcium, because you have your bones are paining, you take calcium, then it's going to be helpful for you. Once they come to us, we do their blood works, we realize that, for example, maybe their calcium levels are extremely high and it's instead causing other things around the kidney. And then we now have to advise them that, look, you see why you need to stop these calcium supplements. You see why you need to stop this. So usually we give them evidence and we educate them through the things that we are currently, through the data that we currently have. And I must say, Ayole, that one of the things that we do is we also are trying to encourage the use of supplements, because we've seen them. We've had the evidence, not in Cameroon, that some of them work, some of them do work. And so we also have like specialized supplements that we use that we actually recommend for people. And drug treatment, drug prescription is really like last resort for us. Not that we don't prescribe drugs, but it's like last resort, because we really want to first of all focus on what are the ways in which you can be able to prevent a particular ailment. And then regarding whether we have this first-hand information data on some of the preventive habits, if implemented, this is going to change or not. We don't have that data, enough data in Cameroon for that. And we are hoping, like I said in my concluding statement, that through what we are currently doing, we can have an R&D department that can be able to, we can have collaborations with researchers that can be able to demonstrate some of the things that we are currently implementing and see whether this is working or not. Of course, as you may know, the limitations in terms of the research space in our country, and we are hoping that this can be developed with professionals like you and others that are here on the field. Thank you.
Great.
Thank you, Achu, for that response. Let's go to Neju Francois. You next.
Good evening, everyone. My name is Neju Francois. I'm from the Family Health and Development Foundation in Yaoundé. Actually, it's Ahmed's question I wanted to ask. He was asking about the One Health implementation in Cameroon, if I got him. And I wanted to ask her to say that the Tackling Deadly Disease organization in Africa started training some civil society organizations last year, and they encouraged them to form a network for One Health. And during the process, 3 organizations were selected to implement One Health activities around the country. And I think one was from Yaoundé. My organization is doing that in Boya. And another one is carrying out the activities in the south, in the east, sorry. And so One Health is really present in Cameroon, and there is already a network of One Health. And I think last time I also spoke here that the organization is also working on the vaccine hesitancy under the platform of One Health. So it was Ahmed's question I wanted to answer. So I think, I don't know if I've answered his question. So we are present in Cameroon as One Health. There are some activities that have been going on, and most of the things we manage in One Health is antimicrobial resistance, food security, COVID, and prevention of zoonotic diseases, especially rabies and monkeypox. Thank you.
Thank you, Francois, for that clarification. And let's go to Theodore Ngachu.
Thank you for the presentation. I'm Theodore Ngachu. I'm calling from the United Kingdom. I have a question for the presenter, Dr. Agbo. You have a project or a practice called Health Lane, My question is, where do you get your patients from? And where do you get the results of your lab test from?
Okay, thank you very much, Theodore. So our patients are everywhere, because this is not just those that are sick, but everyone that is interested in improving their health. So of course, today we are going to different corporates and different organizations and just telling them about what we do and getting them on board. So we have a facility that we are able to run some of the tests that we currently do. So where we get, so of course we also have collaborations like with different health facilities and we have collaboration with different facilities, and we are open to that also for other facilities who have patients, that's those that are already sick, that want to reverse a chronic condition or that want to do weight management and stuff. But in the meantime, like somebody said in the chat, like we call them clients, because these are not people that are sick. We get them from everywhere. We have an online platform website and stuff that we get people, their social media, different corporate bodies that we get them there. And for our blood works, what we've done is that we've invested in equipment also. So we actually do carry out our own blood works at our facility, at our facilities. And what we've invested in are devices, that point of care devices also, that produce reliable results and in very little amount of time. What differentiates us also, like I would like to put here, from typical health facilities, that we don't want people to wait. We know that people are, of course, very busy people who want to come to us, so we don't want to keep people waiting. So you come on appointment, and we ensure that in under an hour, 30 minutes, you're done with the medical doctor and all of your blood samples are available. So that's why we actually invest in our own equipment in our facility.
Thank you so much, Dr. Achu. We're gonna go to Dr. Foma.
Yeah, let me unmute myself. So mine is really more of a contribution. I would really love to, in the future, partner with Achu, just because I'm a big believer of preventive medicine. And being in the oncology field, I feel that in Cameroon, where we can really act in terms of chronic disease is in oncology. I'll take, for example, cervical cancer is the most prevalent cancer in Cameroon right now, but it can be prevented 100%. If you go to a country like Australia, they have succeeded in vaccinating all young girls and boys, and we're able to prevent cervical cancer and actually eliminate it. So you can see what we can do and educate people, so we can actually provide vaccine for this. And you do have something like breast cancer, where it's totally no screening occurs in Cameroon for breast cancer, where in any reliable developed country which has knowledge about this, we are supposed to screen every woman who is above 40 years old to have a mammogram done. But having access to mammograms is almost impossible. I've had the past 2 years, I've had referrals for young girls who are pretty young, and they're actually dying from metastatic breast cancer. Not to even talk about the management, because the management is complex. We have specialists, but the medications are expensive. Getting to that part, we're not even going to help people. That in the US alone has reduced mortality coming out from breast cancer by 90%. We have things like colorectal cancer, where everyone above 45 years old is supposed to have a colonoscopy every 10 years. But it's not done, and Blacks are more prone to having colon cancer than whites. We do know that statistics. A lot of us are now living past the age of infectious diseases, so we're going to develop other problems, which are going to be oncological problems, and you don't know exactly. Just by screening, getting a polyp and taking it out, it's very essential. So I see his platform really as a means of collaboration and expanding and getting into other fields where we can actually really help people. You have things like prostate cancer, which is the #1 in men in Cameroon, where Screening is controversial, but there is a place for it. Getting a PSA in the right patient is a place for it, where you can get it early and treat people hormonally. Not necessarily doing a prostatectomy, but there are other forms of treatment, there are other forms of castrations that do work. We do have a high level of smoking in Cameroon, where we could do low density CT scans and get nodules identified early and treat them. But the question in this case is, when we identify them, which are the cardiothoracic surgeons who will take them out? That becomes a big problem. We have a high burden of hepatitis C. Liver cancer in Cameroon is extremely high, and there is now treatment for hepatitis C, which is 100% efficacious. It's the most efficacious infectious disease that you can treat right now. Actually, the treatment is almost 100% of the patients actually do get better and cure. Gastroenterologists will tell you that with infectious disease. So, and it's going to lead to prevention, and we have high alcohol intake, prevention of hepatocellular carcinoma. I'm talking this now from the field where I work. You do have things like ovarian cancer, where we could screen women or families that have genetic predispositions to, those who have the BRCA gene, they have predisposition to ovarian cancer, pancreatic cancer, breast cancer. These are cancers you see, which are clusters in families, and you see them in young families, and you can actually help them. We are lucky that we don't have melanoma, but melanoma screening is something that we do here. But I just wanted to give, I'm trying to tell Dr. Ashu, or just encourage him, that what he's doing is the beginning and the tip of the iceberg. And I think there is nothing, as I've said before, Elvis, you know, I usually say that I'm a physician, but I do believe strongly, because data talks, by changing the way we look at cancer. When the publication was done by Rush Brothers in 1984, it cracked down oncology, because people could not believe that someone analyzed all the chemotherapy we had been given from the time of Faber right up to 1984 in New England Journal of Medicine, and showed that we're killing people. In the US, we're not curing people, we're killing them. And we had to rethink our measures and rethink strategy. Prevention was what was helping. Treatment in itself helps very few people. We're getting better now. As I can tell you, we're getting real better. It's an exciting time to be in oncology, but the best way to do is to prevent diseases. I just spoke about oncology itself because I have not seen it integrated in Cameroon that much. But these are all ideal things that you can integrate in the healthcare system and try to prevent people from getting diseases. I've had family members who have died from colon cancer. The day it was discovered in the hospital, they were about 65, got a colonoscopy. They never had a colonoscopy, they had metastatic disease. Had multiple friends, young friends and families who have died from breast cancer. Accessibility to mammogram is almost impossible in other regions other than Yaoundé and Douala. Even in Yaoundé and Douala, it's a hustle. Even to get those who will read the mammograms, it's a hustle to get, but all women are supposed to be screened for breast cancer at the age of 40 going forward. Those who have a history of breast cancer in their family, they should screen 5 years earlier to the person who was diagnosed. If it's a close family member, those are things we are supposed to do actively. And I think that preventive medicine is one of the keys. I know we're going to talk about, Achu spoke a lot about metabolic diseases, diabetes, hypertension. The burden of disease is changing in Africa. We're doing a good job in infectious disease, but we don't continue. Like, as he said, we do give the prenatal vaccination for kids, but nobody even understands that they're supposed to get booster doses. Nobody understands that they're supposed to get other doses in order to help keep them alive. Nobody even knows about that concept. So I just want to tell him congratulations for what he's doing. And I think there is a big way forward for collaboration. There is a big pathway forward to improve, and there is a big pathway forward to actually tell the government, enact laws that institutions and government is the biggest employer in Cameroon. They can actually make everyone get a colonoscopy at the age which is required. Mammograms can be made available, and they can also lead this pathway forward. Thank you.
Thank you so much, Dr. Fulmer. That's a good one. Yeah, like you said, like the government can make this available. So let's see how it goes, and let's see how the future holds with healthcare in Cameroon. So we're gonna go next to Miranda. Miranda.
Okay, good evening. Ndamo Miranda Ijang. I'm a final year nursing student. And my question goes to Dr. Ashu. So from what we were taught in school, we're made to understand that primary healthcare has to do with helping people at the most peripheral level to get access to good healthcare. So my main concern actually is about people in communities who don't have access to things like internet and maybe even access, say, to organizations like HealthLink, where they can actually have this exchange and know more about preventive medicine. So how do we is HealthLink in partnership with some integrated health centers or clinics in the communities to best help propagate preventive care into communities? If not, are there programs offered or carried out by HealthLink or related organizations to encourage preventive medicine within communities? And also, you spoke of the need of presenting statistics to clients to help them to really understand predisposing and risk factors of them developing certain diseases, which probably some practitioners in these communities may not have access to. How else do medical personnel also encourage primary or secondary prevention without necessarily presenting these statistics to clients, especially if they don't have access to any?
Oh, thanks so much, Miranda, for your question. And I mean, it's a question I was expecting. We can only do as much at HealthLink when it comes to access. So we've begun in the urban areas where we feel the burden, especially of non-communicable diseases, is high. Like I said, rapid urbanization. So there's a lot of shift to the urban areas. So we can only test and make sure that this model is working well, and then we can be able to replicate that in other areas. Different organizations will probably start in the peripheral areas and then move to the urban areas, but we decided to start with the urban areas and then we'll move to the peripheral areas, and we cannot do all of that at once. The concept of scaling, that's having an impact in a larger population, what may work here may not necessarily work in the peripheral areas. So that's why it's important that we begin small and then we grow from there. Definitely we have plans to grow that to the different peripheral areas where access to preventive healthcare services is also important. And your second question around how else can practitioners implement some of these preventive habits even without necessarily having this data. So I think that it has to deal continuously with education. It's always difficult. Like, people are moved by what they see. If you don't tell somebody that, look, this is the data that is showing that this thing that you are taking is not working or is working, it's difficult to change behavior. But with continuous education and continuous way in which we approach the individual can be able to help. One of the things that we are learning today is when we are taking our medical history, we try to be as very detailed as possible to understand the life of the individual, and then once we relate with them, it's easy for them to be able to adopt some of the things that we are giving in terms of recommendation. I'm going to give you an example of a barrier that we may sometimes create. Somebody comes to you and is telling you probably about how he has multiple sexual partners. Of course, morally speaking, you will want to advise that person to probably use condoms to prevent HIV or to prevent STIs. Meanwhile, today there is PrEP that exists, right? And the person is just wanting something that he can take, and then you can continue to give the add-on on why it's important for the person to move from one one of these or to associate both practices. So what I'm trying to say is that most times we as health practitioners already create the block such that people are not able to express themselves fully. And the moment that they are leaving from there, it's difficult for them to implement some of the things that you have given them or even to accept some of the things. So they always go with their belief. So if there is a way. The gap there is that we don't have enough time to be able to relate with different patients and different clients. But in our context, we are trying as much as possible to ensure that we spend a lot of time with the person that is in front of us to understand you before moving forward. Hopefully, with the learnings that we are having, we can be able to share that to other practitioners so that they can be able to implement properly.
Great.
So next, we're gonna go to Christelle. You're next.
Yeah, thank you. Dr. Ashu, I'll express myself in French. I hope it's okay for you.
Yes.
Okay. So, merci beaucoup. Merci pour la présentation. C'est très important. Je crois aussi beaucoup à la médecine préventive pour notre contexte, surtout que le système de santé n'est pas assez bien développé avec l'assurance et tout ce qui va avec. Et du coup, ma question a deux volets. Le premier, c'est je voudrais savoir, est-ce que tu peux partager avec nous une de tes success stories, que ce soit positive ou négative, dans la médecine préventive, ton expérience que tu as déjà depuis 3 ans déjà sur le terrain, dans notre contexte. Et la deuxième question, c'est pour les patients, pour les clients que tu reçois, que vous recevez à Healthline et qui ont besoin de faire, par exemple, vous recommandez des activités sportives. Est-ce que vous avez une plateforme où vous regroupez toutes ces personnes pour initier au moins l'activité avant que chacun puisse rentrer dans son lieu de service ou alors dans son domicile pratiquer, au moins pour faire ce travail de groupe qui permet parfois aussi de motiver les uns des autres et améliorer le résultat. Je ne sais pas s'il y a, ou alors c'est en perspective que vous pensez le faire. Merci encore, beaucoup de courage et c'est très salutaire. Merci beaucoup.
Merci beaucoup, Christelle. I hope that I can explain in English. That's okay. All right, thank you. So, in terms of success stories, there are several, but I'm just going to give like a few, maybe in terms of detection and in terms of reversal that we've currently seen. We had a lady that came, for example, and she had been to Nigeria, was managed for high blood pressure, has received several treatments, and I think she came back to Cameroon, and then she was told by the doctor that is following her up, unfortunately, don't eat this, don't eat that, you are having kidney failure, you are that. And a woman that used to be once bulky has become really shrinked because of the stress that comes with you are dying very soon. You already have a heart disease and stuff. And Christelle, when we consulted that woman and did all of her parameters, that woman had adult malnutrition that was having an effect on the heart. Her protein levels were all low, and she was all stressed up because of what she had been told. These are one of the stories of people that we are detecting early. And today she's on the treatment plan that we've given her, and we are seeing her getting better. These are one of the people that we've been able to detect. Another lady has moved up and down, complaining of stomach pain and stuff. And because, of course, there may be a thought that it's a gynecological infection, there's always been that direction that people have to always think, and she has always been having a stomach pain, came to us, and as part of our comprehensive plan, we just let's check all of the systems, and we noticed that it was the liver that had the problem. And because the liver had the problem, we had to refer her to a specialist. This was managed, and now she's feeling fine. But this was somebody that in the next 5 years, 1 year, 2 years, should have died because of something that was really very neglected. So in terms of early detection, we've seen a lot of success stories around that. In terms of habit changes, people that were sleeping for 3 hours, 4 hours and didn't know why, are now sleeping 7 hours, 8 hours, and sleeping very peacefully because of what we have detected and because of the change in which we have, the advice we've given to them. Look, if you don't do this, this is what is going to happen to you. So those are some of the success stories that we've had. For those that come to us, and do we have a platform to initiate them to do some of the recommendations? Yes, sometimes we do organize such platforms, such as the exercise. There was a time we organized like a yoga platform for those that wanted to reduce the amount of stress. So we did yoga platform. There were others that we did like a 4-minute exercise for those that are very busy. I'm going to send to Mr. Elvis Ndasi so that he can be able to do in his office for the 4-minute exercise, which is an exercise that has been shown that if you are very busy and you do it, it keeps you much more active, keeps your heart beating, and has even been shown to even affect hypertension reversal, the nitric oxide dumbbell exercise. So we do initiate some of these platforms. Again, we can only initiate as much because the people that come to us are always very busy people. Those working in corporates and banks are always very busy. So we can only initiate as much. But the one thing, like I said, Christelle, is that there needs to be some multi-stakeholder engagement. If we are consulting corporates, people in corporate, we expect that the corporate organization be able to set up a gym, be able to set up subscription for a gym for individuals, or things that are going to help people engage more in physical activity. For example, the needs with the occupational health doctors need to be set up systems that are going to prevent people from falling sick. And unfortunately, I mean, it's sad to say, but the occupational health gap in Cameroon also is problematic, because people do tests just because. I saw it firsthand when a gentleman went for his occupational health consultation. They did his blood test, and the nurse came and gave him the results. And the guy was like, "But what do the results say?" And the nurse was like, "If the results said that you had a problem, we will have told the doctor, or the doctor will have spoken to you." So it's just for formality that some of these things are being done, and we want to change that narrative. And we believe that it involves lots of stakeholders to be able to do that. So thanks.
This is great. I'm waiting for my 4 minutes sports directive, and I'll share it with Mono. He's more busy than I am. I think he needs about 2.5 minutes. That would do something that 30 minutes cannot do. I would want to call on Brian Tegomo, one of our co-moderators. We are happy to have him. I know he's busy now. I might not show his face, but I think he has a question, and I'm sure from there he might help us call the subsequent questions that are up.
Yeah, thanks a lot, Elvis. And Dr. Asher, I really just wanted to express how truly honored we are to have you. I've really been looking forward to this exchange. I think what your team, you guys did with Gifted Mom was really a tremendous success. I'm in a noisy background, currently in transit in an airport, so it might be a little bit of noise in my background. But I do have a question.
Elvis, we lost him.
We might guess the airport. We lost him, and we would want to imagine that he's going to get back to us as soon as he gets back his connection, and then from there he will tell us the airport. That is very interesting. We want to call on Edwidge before we see if we're going to get back to Brian.
Okay, hello everyone. Please, I will speak in French.
Yes.
Oui, moi c'est Edwidge Cameroun, médecin généraliste, actuellement en première année en management des services de santé. Je voulais remercier le docteur Agbo pour la bonne présentation et l'initiative qu'il a prise. Et j'aimerais aussi préciser que c'est un sujet vraiment vaste qui touche, parce que la médecine préventive est vraiment un point focal sur lequel on ne tient pas beaucoup compte au Cameroun. Pour moi, ce n'est pas tellement une question, c'est plus une réflexion. Moi, je pense que le problème de la médecine préventive commence déjà au niveau au niveau des prestataires de santé, parce que je pense que il y a d'abord une mauvaise information au niveau des prestataires de santé. Déjà, les responsables de la santé parfois ne sont pas bien informés. Ils n'ont pas la bonne information. Du coup, ils ne peuvent pas aussi bien informer la population par rapport à cela. Et je pense que parfois, le problème vient au niveau de la formation que nous avons reçue. Parce que quand on regarde les différents thèmes que nous avons étudiés durant notre formation, il y a très peu de thèmes qui parlent de la médecine préventive. On parle la plupart du temps des maladies infectieuses, des maladies, mais il y a très peu de matières sur lesquelles on parle vraiment de la prévention des pathologies. Je ne sais pas si à partir de sa plateforme, ils peuvent penser peut-être à la sensibilisation des personnels de santé sur l'importance de la médecine préventive avant même déjà d'attaquer la population en général. Merci.
Merci beaucoup, Edwige. Je pense que c'est une recommandation qui est extrêmement importante et nous allons tenir ça en compte. Et ensemble, on peut travailler pour voir comment mettre ça en œuvre ensemble. Merci beaucoup, Edwige.
Merci.
Thank you, Edwige, for your question, and thank you, Akbar, for your bilingualism and fluency in French. When the other question was asked in French, I thought you were going to say you cannot talk something where you don't know, but now you just proved me wrong. And thank you so much for this eloquence in French. That's what Cameroon is. Christelle, Aisha.
Hi, everybody. I think I can ask also my question in French. Mon nom, c'est Christelle Taïcha Komoto. Je suis médecin spécialiste en médecine préventive et santé publique au Canada, ce qui fait que c'est vraiment un sujet très important pour moi. Puis je suis vraiment très contente de cette présentation. Elle est excellente avec beaucoup d'informations. J'ai une petite préoccupation par rapport aux inégalités sociales de santé. J'imagine que c'est quelque chose qui vous préoccupe aussi. Déjà, en médecine curative, on a un gap entre les plus riches et les plus pauvres. En médecine préventive, ça va être encore plus important. C'est encore les plus riches, c'est encore les mieux éduqués qui vont pouvoir avoir accès à vos services et à l'information. Alors, ma question, c'est comment vous pensez qu'on peut travailler à réduire ces inégalités? Il y a quelqu'un qui a mis dans un commentaire de faire beaucoup de publicité. Je pense que c'était un très bon commentaire parce que au-delà de la publicité par rapport à la clinique, à vos services, c'est la publicité et la promotion finalement de la médecine préventive et de tout ce qui est prévention. Est-ce que vous avez dans votre offre de service en arrière de la tête l'intention d'aller vraiment beaucoup plus loin en termes de promotion et de publicité pour justement réduire ces écarts et s'assurer que les moins nantis puissent avoir accès à l'information et aux services?
Merci beaucoup, Christelle. Ta contribution est extrêmement importante et nous avons pris ça en compte. Première chose, c'est que nous avons essayé de faire en termes de même les différents prélèvements sanguins qu'on fait. Les prix chez nous sont 10 fois moins que les prix dans les hôpitaux. Donc, ça, c'est ce qu'on a essayé de faire en termes pour que ça soit plus abordable. Ce que nous faisons en termes d'analyse d'environ 50 paramètres pour 50 000 francs, par exemple, va coûter environ 150 à 200 000 francs dans une autre formation sanitaire. Donc, nous avons essayé de faire cela. Néanmoins, on sait que ce n'est pas abordable pour tout le monde, mais on a essayé d'implémenter cela. En termes de promotion, je pense que c'est un point qui est extrêmement important que nous avons tenu en compte et que nous allons et qui revient plusieurs fois et que nous allons mettre en œuvre. Et on aurait besoin aussi de votre contribution. On peut être en contact pour aussi nous guider sur comment nous pouvons implémenter cela pour que ça touche plusieurs populations. Merci beaucoup une fois de plus.
Merci.
Brian is back. Brian, over to you.
Yeah, so sorry. I really apologize for that. And so I think Christelle touched quite a little bit on my question. Because I was very much question really around the transition around from the non-profit, given on that transition to helpline. I'm wondering if that may have had an effect on your outreach in general, in terms of how many people you're able to reach. And I think that's really an important question, especially now that we are experiencing this great transition from infectious diseases to non-communicable diseases, particularly in Africa. I think I'm really curious how that switch in business model is affecting, potentially affecting how much of your outreach. And I have a question around your database system and how is that being done, and electronic record, the lab electronic recording or health system. I'm curious how you're managing all of that data and the security around that data and all that. Thanks.
Thanks so much, Brian. So, of course, in terms of the reach, today, switching from Gifted Mom to HealthLane, the reach is going to be more because we are of course, with Gifted Mom, it was limited to pregnant women and nursing mothers. And we are hoping that with HealthLane, it can even have an additional population to get many more people. It's true that today it's Gifted Mom was not for profit, and HealthLane switching is for profit. So in terms of access, we may have some limitations. However, what we are trying to do is to ensure that as many people as possible get the information. I mean, with some of the contributions that have been gotten here in terms of health promotion, how can we be able to get to more and more people, and even just replicating what we are currently having, maybe on a smartphone application, and reaching to several more people. This is work in progress, and we are hoping that we can be able to achieve that, because this is not just a problem of the urban areas, it's also a problem of the rural areas and a problem for everyone. In terms of data recording, so we've developed our own platform that records all the data in terms of the blood works for individuals. We have all of the records in terms of the medical history of the individuals. And these definitely secured by our technical people. I think it's HIPAA compliant. So we have all of that data recorded. And that's why I said we are always definitely open for those that want to do maybe an extensive analysis, or if there's something that we need to do to be able to improve our impact in terms of research. We are definitely open to experts like you to assist us in that. Thanks.
Great. And we are getting almost towards the end. This is almost 2 hours of conversation, very interesting conversation. We have 2 more hands up. We'll start with Karim Charles, then we go to Dr. Munoken. And I think from there, we will be wrapping up with the question and answer sessions. But of course, a lot is always happening at the end of the session at the parking lot, where we have, a free conversation with Dr. Agbo Ashu to ask some more direct questions.
Hello.
Yes.
Yes, I am Karim Charles, and I am a dentist in Yaoundé. Thank you very much for your presentation, Dr. Ashu. I really enjoyed it. And yes, we've heard everything else, but I think in Cameroon, we also have a serious issue with preventive dentistry, to be precise. I have a serious issue with preventive dentistry. I know I'm shooting it right here. So what's HealthLane up to when it comes to preventive dentistry? That's my first question. And then my second question is with the insurance.
Sorry, the first question you were breaking. So we have an issue with preventive health.
With preventive dentistry.
Preventive dentistry. Oh, yeah. Okay.
Mm-hmm. Which is actually never really touched in Cameroon. So yes, and I'm hoping that helps me something about that. Then the second one is with respect to the insurances. There are certain insurances whose names I could call, but I think I won't. They basically allow patients they cover their consultation fee. I mean, here in Cameroon, right? They could cover their consultation fee, but will not want to cover those other lab workups because the patient is so-called not sick. Like they themselves have a problem with the preventive care part of it. Yes, you mentioned corporates, and there are some which really do what we call in French systematic, and they want their employees to, from time to time, go do checks, whether they are sick or not. It's actually mandatory. But what about these private clients, let me put them that way, who subscribe to an insurance scheme and they want to do the preventive checks? How has it been received? How has the insurance schemes been receptive to your vision?
All right. Thank you so much, Dr. Karim. So for preventive dentistry, very important aspect, even things around preventive ophthalmology, which we've not currently included due to the cost of setup. And we are hoping that as we are evolving, we can be able to add that. And if there are better ways in which we can be able to collaborate on that, that's going to be important. One of the things that we uphold as standard and value is really excellence, and that's why we find it difficult, not that we don't refer, we find it difficult referring to different facilities. For example, wait time. When somebody comes to a facility, you don't wait a lot and you receive immediately, versus when you go to another facility and you have to wait for an hour, it's already it already stresses the person up, and the person doesn't want to see the need for that. And that contributes to the reason why some people choose not to go to the health facilities, because there is a lot of wait. I've experienced it myself, so I hate going to the health facilities because the wait time is really high. But in terms of preventive dentistry, I think it's an important aspect, and we're going to find a way to set that up as we are growing bigger and bigger, and to incorporate that as part of our different plans. Again, if you have ideas on how we could go about this, we are definitely open to that. In terms of the insurance, so today in Cameroon, we're categorically told by some insurance companies there is no policy for insurance for preventive health checks. So individuals cannot use their insurance to be able to access preventive health facilities, and so they have to pay out of pocket. That's the unfortunate situation with the insurance clients. We've had a few corporate bodies where their insurance, where they've come and covered, and then they've gone back maybe to their corporate body, and then they have refunded them for that. But as a whole, that's like 0.01% of those that have the insurance. But when it comes to preventive health, none of the insurance companies do cover for preventive health care today. So that's the bad news for those that currently have their insurance.
Thank you very much, Dr. Ashu, for that response. And it's really strange. And I think there have to be some conversation around this, especially engaging insurance experts and other healthcare experts to have a conversation around preventive healthcare and insurance coverage. We can do a workshop seminar on that alone, and invite experts to really have a debate on this issue. And I think we would want to see how that can happen, because ironically, here in the United States, insurance company will prefer to pay for preventive care rather than like exactly. You go for mammogram or anything, the insurance wants you to go there. In fact, they even call you and remind you to go for check, because they know by you being healthy, they save money. If you are healthy, they save money. If you're sick, they spend more money. And so they will do everything to make sure that you are healthy. So I think there should be some conversation around this and engaging, seeing how policy makers can hold insurance business stakeholders accountable, and making them to be able to offer these services to the population. And we'll get the last question from Dr. Mono Ken.
Yeah, my question was more towards, it was like you guys just touched it. I think with all the contributions here, I think policy is very important.
Yes.
Why do I think policy is very important? The state needs to provide a pathway forward for these insurance companies, and also universal insurance by the state, in order for those who are underprivileged to have access to preventive medicine. So we need to advocate for this to go right up to the level of the Ministry of Health, to have it as its modus operandi, in order for us to really advocate for preventive medicine to be the pillar of our healthcare system. If we don't do that, it's going to be something for the rich. That's true. And two, insurance companies, like you said, here in the US, if I turn not to do my annual exams, my insurance goes up. because they don't know exactly what's wrong with me. The day I don't even go in for my basic annual exams and I don't do it, the next year my insurance climbs and goes up. And as one of Christelle Acha said, a lot of people have said here, preventive medicine itself, it's the key to reducing mortality and improving life expectancy. And it's so broad that if we want to talk about it, we can talk about it in multiple fields. As Dr. Karim said, in dentistry, there is some part about it, iodinization of water. Putting iodine in water is one big whole thing that nobody even talks about, nobody looks at it, nobody tests for it, in order to reduce tooth decay, fluorination. So things that are basic that everyone has been doing, but there's no one controlling it back home in Cameroon. The eyes is one thing. Neonatal screening. Tomorrow is going to be World Sickle Cell Day. I hold sickle cell very close to my heart. Just that I could not cancel this session to be sickle cell. So tomorrow you guys can join me for sickle cell, Elvis. I would say so, but sickle cell, you'd have the burden of sickle cell in Cameroon, in Africa, hemoglobinopathies. If you do screen these children at birth, which is done in countries where you don't even have sickle cell, there is universal screening of all pregnant women in America, in Europe, even in some African countries, you're able to pick it up. Ghana does it. Everyone in Ghana who is pregnant gets screened for sickle cell. And you know right from birth that this child has sickle cell, and you're able to plan for this child's life going forward. You're able to even screen premarital screening. That's also preventive medicine, so that people don't get married and get children who are going to have defects. And they should know ahead of time. So preventive medicine can be so broad, so large, and we do have the burden of the disease. I'm going for sickle cell because the burden is huge. We have prevalence of AS in Africa. In Cameroon, it's about almost 40% of us carry the AS gene because of evolution. It's actually protective. So we should be able to get neonatal screening. And I think it's not just telling about that. As I told him, he's at the tip of the iceberg, which he has a huge iceberg where he can gain from, he can advocate for. And I think others should join you in the advocacy for us to see that the government takes preventive medicine as a policy. Elvis, thank you.
Thank you so much, Mono. And as you said, sickle cell, you're very passionate about it. We had an expert here to talk to us about sickle cell. So tomorrow, which is the International Day, we are going to get back that presentation and share on our Facebook page for those who were not opportune to be here last year when we had that presentation on sickle cell, just so you can get some really, really interesting statistics about it. I know from the session I moderated that Cameroon has about 500,000 cases of sickle cell currently, which is really serious. These are people who are left on their own with no assistance on what it takes to really survive as a sickle cell patient in Cameroon. It's really been an interesting session. We've heard from Dr. Agbo a lot of issues, but before we get the summary, I'd like to just get around with all the moderators just to get their take on the session before we wrap up the session. And I want to start with Christelle, not with Therese, if Therese is in the house still. Some last words from you, Therese?
Hi, Elvis. Thank you so much, Dr. Achu, for this great presentation. And with this presentation, I've taken out a lot. I'm gonna send a lot of my family members to be doing this because I've been advising them to do preventative health checkups and all of that. But in Cameroon, when you tell your family to do it, it seems like magic. They tell you they're not sick, why should they go there? So it's hard to convince people to do it, but once they do it, they feel better. So thank you so much for this presentation. And I know I'm gonna share this video a lot once we're done with the recording and all that. So more people can come to you, more people don't fall sick, and more people don't die when they don't know what, people just die and they think it's witchcraft. A lot of them have diseases, like you said, diabetes, high blood pressure, and all that. And they can drop dead without knowing what's happening to them. So coming to this preventative medicine, it's really good. It's a good idea, it's a good initiative. And I'm gonna be willing to donate to your cause and all that. So thank you so much for this.
Thank you so much, Therese, for tuning in. And I know we had Francois. Francois, some last words from you. I know your hand was up before we close the session, but I give you the floor.
Thank you. It's always a very interesting program, the Cameroon Town Hall. And I want to also say a word about sickle cell disease, which Dr. Foma knows. It is one of my key activities in the rural community. And it's unfortunate that most of the things we are doing on sickle cell now, we have free screening for ophthalmology, dental, and all call it what. But all those things are happening in the urban areas, but in the rural areas, the sickle cell patients there are just left on their own. So it is actually World Sickle Cell Day. The figures are quite high in Cameroon. We started neonatal screening in 2015, but that neonatal screening is still in Yaoundé alone, and in Yaoundé is only 3 hospitals that are engaged in it. So it is still very, very, some people are not even aware that such a thing is happening in Cameroon, neonatal screening. In Douala is 4 different hospitals, so the other regions are not even covered. So it's a cry, it's a plea for us all. If the trait is as high as 25 to 40%, it means if sensitization is not done, the sickle cell patients will even increase. So when I look at Dr. Ashu's work on preventive medicine, it's interesting to know that it's gifted men that become health lane. That on preventive medicine, it's quite, I begin to ask, yes, you come and do this examination, you do this. When you go to the rural community, how can they afford such money to do the mammography, the PSA? And so something should really be done that should come from the government. But we'll not always wait for the government. There's a kind of sensitization we can also do at the level of the community so that the people really catch the glimpse. With our community have really not known that they can contribute a little bit for their health. So if such a message also is going on, sometimes if it is completely free, I don't know how they take it, but we should also look at a situation where we'll come back to this rural community. From statistics, about 43% of Cameroonians live in the rural community. And if we just concentrate our healthcare in the urban area, we are still not doing enough. So let's see how we also get into collaboration with those that are in the rural community. Thank you. That's a little bit I wanted to talk.
Thank you so much, Francois, for your rich contribution. And we will continue to have this conversation so that some other people will come up with other initiatives and their focus will be the rural communities. And together we can do this work. We'll call on Brian Tegomo to give some last words. And as a reminder, Brian Tegomo is a medical doctor and public health physician to working with the CDC in Nebraska, United States, presently on the move. Maybe he's already boarded the plane. Brian? Okay. If we don't have Brian, then I'll take Christelle and then we'll get the last words from the chair. And then before we hear some words from Dr. Akbar.
Merci Elvis, merci beaucoup à Dr. Akbar, je veux dire grand merci pour la présentation et pour le temps, les informations qu'il a partagées. Moi, ce que je retiens, c'est que c'est très important que nous commencions maintenant à se préparer parce que après les pathologies infectieuses, on fera face aux pathologies non transmissibles et qui pourtant peuvent être, qu'on peut prévenir. Donc, c'est important déjà de manière individuelle et collective dans nos petits milieux de service à favoriser les activités sportives déjà et l'éducation en attendant d'avoir les flyers à travers HealthLane et tout le reste. Merci beaucoup, Dr. Akbar, et c'était un plaisir de vous écouter ce soir. Merci à tous ceux qui ont pu se connecter aujourd'hui. J'ai vu qu'il y avait aussi Guinui, voilà, qui était là, notre invité la dernière fois. Merci à chacun, merci infiniment. Merci à Elvis pour co-modérer, et à tous les modérateurs de la session d'aujourd'hui et très bon week-end.
Merci beaucoup, Christelle. And we'll call on our own chair, Dr. Monoken, for some last words on this session.
Yeah, Elvis, I just want to thank all the moderators, and I don't know how you guys do it. And I want to say a big thank you. I think we're making a lot of strides. We're changing a lot of minds back home. We're having a discussion where the diaspora can actually talk to healthcare professionals back home. We're having a lot of collaborations already taking place. As you know, you are a witness of a lot of things that are happening. And I think that the first thing is to say thank you to all the moderators who are here every 2 weeks in order to moderate this and to get to fish for different speakers that can actually lead the discussion. It's a town hall. I've always said we're leading a discussion. The speaker doesn't know everything. And I love the way Dr. Ashu did it. It was wonderful. I'm proud of him right from the days of Gifted Mom. I can say I'm his big brother who is proud of him, who is really proud because I saw what they started, and I sat and each day I thought about it, how they could change the lives of pregnant women, and going with that same concept and trying to change the life of every single Cameroonian, and promoting preventive medicine and promoting better healthcare, promoting something that can actually help to improve our life expectancy really in a real tangible way is the way forward. So Elvis, thank you, and thank you, Dr. Agbo, for everything you're doing. Continue the good work. Look for partners. I've always told you, and I'm going to hide it, you have to rekindle the Gifted Mom idea, because it's a wonderful idea that was targeting a specific population that can really benefit. It should be part of maybe a philanthropic part of what you guys are doing, could still stay alive. And that's going to be my take. And Elvis, just because of what everyone is going through tomorrow, it's not a town hall thing, but same time, I'm planning to organize a session on live Facebook where we could talk about sickle cell and just answer questions. So those who can join me, especially Francoise, she can join me. I'll send her the link. We can go online and talk about how to help sickle cell and actually advocate for Cameroon. Thank you.
Thank you very much.
Appreciate it. I'm waiting for the link.
Yeah, I will send it to you.
Thank you very much, Chair. Thank you for all the hard work you do behind the stage to get these presentations and get all these excellent speakers to our town hall. And thank you for your leadership. I want to say here before I call on Dr. Agbo Ashu that last session we were talking about cholera epidemic in Cameroon. And we heard that during the epidemic, the peak of the crisis in Limbe, there was an isolation unit that was set up just to make sure that all patients were treated in that unit. And we heard a very touching testimony by the regional delegate of health for the Southwest region, that at this unit, the medical doctors, nurses, and healthcare workers were all together with the patients there, and were isolated from the entire population, and were only served food for the number of time or days that they were there. And we made a pledge here at the town hall that the moderators were going to do some symbolic gift to these workers whom we consider them heroes, to say thank you, and to say, even though their actions are sometimes considered to be their main job, but we always have the responsibility to say thank you, and to say that during pandemic, everyone have to consider healthcare workers like heroes. If you are a restaurant in Limbe during a pandemic, you can decide that I'm going to serve lunch to all healthcare workers who are in that isolation unit. So everyone has a role to play to show our healthcare workers that their work they are doing means a lot. It's such invaluable contribution. So we promised to send some money to over 60 workers that were isolated during that period. And we kept to our promise. The moderators of the Cameroon Town Hall have already disbursed a sum of 1,250,000 francs to the regional delegate of Southwest to be distributed to these workers to say thank you. And we did this on behalf of you all, the Cameroon Town Hall for Healthcare Professionals. So thank you for your always tuning in every fortnight, for keeping this very amazing platform alive. And of course, Dr. Ashu, your last words before we end the session.
Thank you all so much, Dr. Mono. Thank you so much for always encouraging. And thank you, Elvis, Nasi. I remember calling you to receive some guidance, and we haven't finished that conversation. Hopefully we can continue that conversation. And all the wonderful co-moderators, Christelle, Theresia, Dr. Brian, Thank you all so much. I mean, it's really an honor to be here this evening, afternoon, wherever you are, morning. And prevention is absolutely the way forward. And with prevention, we can be able to better our lives. We can even extend human life. I mean, our parents of those days lived longer, healthier, without any wahala and issue. And I believe that it's possible even in our days if we only develop the consciousness. It's not a one-man thing, so it requires several stakeholders. And I believe that together, each and every one of you who have listened to us this evening, you can give your contribution in one way or the other, and we'll really be open to that, to working with you to be able to improve preventive health in Cameroon, in Africa, and the world at large. Thank you all so much, and the Cameroon Town Hall, please keep doing what you are doing. It's really been a privilege to be here. God bless you.
The topic today was access to healthcare, to preventive healthcare in Cameroon, and our guest speaker was Dr. Ashu Agbo. We heard that preventive healthcare deals with prevention of illnesses to decrease the burden of disease associated with and associated risk factors. And Dr. Agbo Ashu told us that WHO mentioned in 2018 that NCDs accounted for 35% of all the deaths in Cameroon. And these are all caused by issues such as obesity, which is on the rise in Cameroon. We also heard that about 20% people have the probability of dying between the ages of 30 to 70 if nothing is done to prevent non-communicable disease. And non-communicable disease are the world's leading form of preventable illnesses. He took us through some basic principles of healthcare prevention, and he said there are 4 levels of prevention. The first is the primordial prevention, which has to do with hygiene and sanitation or actions that are taken to prevent future hazards. He also told us about primary prevention, which is the prevention of onset of chronic disease by reducing risk factors of development. We also talk about secondary prevention, which is the detection and treatment of preclinical changes, that is screening for things like hypertension, diabetes, and cancers. He talked about tertiary prevention, which is, it focuses on reversing or arresting or delaying disease solely in the clinical realm. So Agbo had to take us to the situation in Cameroon, and we saw that unfortunately our healthcare system is designed to focus more on curative health, though the government has done a lot by putting in place programs that also help to prevent disease, such as the expanded program on immunization, other screening programs. Some few days ago, I saw the Minister of Public Health signed a decree creating treatment centers for hepatitis C. Just as Muno mentioned, the crisis of hepatitis in Cameroon is really on the rise, and these are efforts government is putting in place. Though some policies exist that has to do with prevention, they are poorly implemented. For example, enforcing smoke cessation or preventing the high consumption of alcohol. And this is why Dr. Ashu Agbo said there is need for interministerial collaboration to enhance the implementation of primordial or primary healthcare prevention. And he also identified the fact that there are cultural factors that create gap in the prevention in the preventive healthcare arena in Cameroon. Then we now had to ask him the question, what do you do to solve this problem? And that's when we heard about HealthLane. HealthLane is a preventive healthcare company offering comprehensive wellness checks, personalized care plans, and health coaching with a mission of simplifying the way people understand, track, and improve their health and enabling longer and healthier lives. And they have facilities in Cameroon and Nigeria. And what they do is they do risk profiling, medical history, and then they do blood screening, urine screening, body composition analysis. And when they find out something, they present the lab results with what they have discovered, and then they lead the individual through the pathway to either prevention or to direct the person for treatment. Then they use digital health or on a smartphone or through an application to be able to monitor their patients. They have programs such as weight management, diabetes and hypertension reversal program, STI prevention programs, aging and longevity program, which I was personally interested in, as well as Christelle, adult immunization programs. And of course, Agbo told us about the fact that This work cannot be done by Health Lane alone. It requires collaboration. It requires a specialist to push for preventive healthcare in Cameroon. It requires research and development. And of course, it requires recommendation of Health Lane to our people for them to understand that such an innovation exists in Cameroon at a price that is lower than the conventional price you find in other hospitals and healthcare facilities, at a turnaround time that is far less than the wait time you find if you go to a conventional hospital or healthcare facility. That is why we call on all those who have been part of this session. If you have a parent back home, it is time to refer them to Health Lane to get themselves screened and to get the best pathway towards prevention of non-communicable disease. Once again, ladies and gentlemen, it was a pleasure having you on this session of the Cameroon Town Hall, and we look forward to see you during our next session in a fortnight. Have a nice weekend, and of course, stay with us.